Hello again and welcome to my YouTube channel. Today is YouTube video number 24. Wow. And I'm going to be talking to you about schizophrenia in children and teenagers. My name is Tracy Maxfield. I'm a nurse, peer specialist, mental health and stop bullying advocate and educator. And this channel is dedicated to all things relevant to mental illness, mental health, suicide and bullying in our children and teenagers. So some very quick housekeeping before we begin. As I say every video, please consider subscribing to this YouTube channel. Just press the button below, and each YouTube video is accompanied by a much more detailed article which is in my blog post, which can be found on my website at www.tracymaxfield.com. And also don't forget to check out the new online course I am presently offering, 8 modules, mental illness in children and teenagers, what you need to know. So the very mention of the word schizophrenia, I think with most people conjures up images of quite a out of control, demented person who is quite violent and aggressive and can cause harm or do very weird, erratic things. And I think the challenge is that it is greatly misunderstood, and also because we've kind of been brought up, fueled no less by the news and the social media about the negative and scary components of schizophrenia. It is a mental disorder that few people understand, and many are actually quite scared and intimidated by it. So as you can imagine, if as adults we can feel a little overwhelmed trying to understand schizophrenia, how are we expecting our children and teenagers to deal with this, and also their parents and family and siblings? So schizophrenia is a chronic and severe mental illness or disorder affecting the domains of the brain involved with thinking, perception and behaviors. Sadly, it requires lifelong treatment, which usually comprises of medication and ongoing periods of life skills training, counseling, community supports and resources, and inpatient hospitalization, when the symptoms are most severe. So I think, yes, children, teenagers, adults with schizophrenia will display some unusual, unpredictable and erratic behavior because they act on their delusions and hallucinations, which comprise part of the disorder, and they're unable to distinguish fact from fiction. However, what research is now finding is that if we're actually able to identify schizophrenia in its early stages and begin a treatment plan which comprises therapy and medications and community supports and resources, then there's a better opportunity for the child or teenager to actually stabilize, learn to manage signs and symptoms, and actually go through life not unscathed by any means, but maybe not experiencing so many of the severe and quite harsh outcomes that can result if the disorder is not recognized and treated, or if treatment actually is stopped. So the exact cause of schizophrenia is still unknown, but what we do know is there definitely seems to be a genetic component, a hereditary link there, plus some brain chemistry and the environment. And if you remember back to 1 and 2, videos 1 and 2, when we talked about ACEs, adverse childhood events, and how mental illness is derived from genetics, internal and external environment. The internal environment is in utero. The external environment is the environment in which the child or teenager is exposed to on a daily basis, both in the community, in the home, in school, and the relationships around them. So risk factors for schizophrenia: family history. Interestingly, older age of father. Increased immune system activation, such as diagnosed with an autoimmune disorder. Taking mind-altering medications, mainly drugs, as a teenager. And pregnancy birth complications, so malnutrition, toxins, viruses that may actually affect utero in brain development. Now, normally the signs and symptoms of schizophrenia usually start showing between the ages of 16 to 30. However, scientists have found that there is a very rare form of schizophrenia known as early onset schizophrenia or childhood schizophrenia, which is actually increasing, and it presents around 7 years old. In over half of the children who develop schizophrenia, what they have found is that the actual early signs and symptoms presented themselves within the first few months of the baby being born, and continued as the baby grew into the developmental stages. And so the problems that they noticed was late or unusual crawling, late walking, abnormal motor behaviors, and language problems. Now, what's important to note is that these developmental problems can also be found in children with what we call pervasive developmental disorders, such as autism spectrum disorder. Therefore, it's imperative that there's actually a physician assessment and an accurate testing, diagnostic testing, history, pediatrician looking at developmental milestones to determine if it in fact is early onset schizophrenia or childhood schizophrenia, or it could be autism spectrum disorder. Now, another complication is that childhood schizophrenia also presents with similar signs and symptoms to bipolar disorder, PTSD, depression, some severe personality disorders, and even OCD, obsessive compulsive disorder. Hence, I cannot stress. It's imperative, obviously, that there's pediatrician and physician follow-up and assessment. So according to the American Academy of Child and Adolescent Psychiatry, they list very specific symptoms which are typical of early childhood schizophrenia. And what you're actually going to find is that most of these signs and symptoms are actually very common in teenage and adult onset schizophrenia. So I'm actually going to read them because they're quite long and detailed. Odd and eccentric behaviors, catatonic behavior, extreme moodiness, severe anxiety related to the delusions and hallucinations, self-isolation and difficulty making friends, poor hygiene, unwillingness to bathe or wash, communication impairment, poor eye contact, blunted affect, avolition, believes television and dreams are real. And excuse me whilst I turn the list over. And so, as you can see, many of these signs and symptoms do look like very much like autism spectrum disorder. Now, in teenagers, the signs and symptoms are also very similar, albeit a little bit more difficult to recognize because many of them in their early stages present as if the teenager is just going through a stage, so maybe dabbling in substances and drugs, drinking, alcohol, lack of motivation, strange behavior, social withdrawal, problems at school, problems with friends. But as time progresses, the symptoms become much more obvious and actually increase, and they're categorized into 3 specific groups: positive, negative, and cognitive. So the positive symptoms are thought disorders such as disorganized thinking, word salad, hallucinations, that's seeing and hearing things that don't exist, delusions, that's a false belief not based in reality, and movement disorders, which is unpredictable mood swings, childlike silliness, easily agitated. Negative symptoms are flat affect, reduced speaking, decreased feelings of pleasure in everyday life, and difficulty starting and continuing activities. And then the cognitive symptoms are going to be trouble focusing and paying attention, poor executive functioning, that's decision making, problem solving, assessment, and problems with their working memory, that is their ability to use information immediately after they've learnt it. Now, if left untreated, child schizophrenia or teenage schizophrenia, eventually they may become psychotic and experience a break from reality, and at that point hospitalization is required, usually under a certification order. Now, untreated or inappropriate treatment of early childhood schizophrenia can result in severe emotional, behavioral and health problems, physical problems in not only in adolescence but also in young adulthood and then in later life, and its consequences can be far-reaching, hence the need to get early assessment. So let's say if it's untreated, or if it's misdiagnosed, or if the treatment is stopped. For example, it's not uncommon that schizophrenic may decide to forego treatment because of the way the medications make them feel. Other coexisting mental disorders can occur: anxiety, self-harm, non-suicidal self-injury, depression, family conflicts, social isolation, turning to substance abuse, alcoholism, cigarette smoking, very common. Victimization, they become more susceptible to crime. Social isolation, bullying, inability to live independently, inability to manage in school or even at home, that's why lots of them end up being runaways, homelessness, and ultimately suicide. Suicide is actually very, very common in children and teenagers with diagnosed schizophrenia. So when do you seek help? Well, if your child has significant developmental problems, and to be perfectly honest, pediatricians should be picking up on those. Reduced socialization with friends and family, failing grades in school, suddenly adopting strange eating rituals, maybe hearing voices or seeing things which aren't there, stops bathing and dressing, excessive paranoia and suspicion of others, lack of emotion or inappropriate emotions, and that's kind of like acting out in childlike silliness, strange, bizarre ideas and fears, unpredictable behavior, agitation, aggression, violent outbursts. Obviously, if they're self-harming, bizarre ideas, bizarre speech, rantings, ravings, what they may draw, what they may paint, what they may write, what they say, their actions, all of that indicates something is not quite right. Constant suicidal thoughts and behaviors, and confusing dreams and TV shows for reality and for actual things that are happening. Treatment plan for schizophrenia is medications, and I'm talking lifelong medications, usually antipsychotic drugs, plus if there's a coexisting mental disorder, treatment for that, and if there's a coexisting substance use disorder, a dual diagnosis, obviously there will be treatment options for that. Psychotherapy, family counselling, individual counselling, talk therapy, cognitive behavioural therapy, community support's extremely important, and life skills training. So we need social and academic skills training to help them in school, if they end up going to college, university, supported employment, vocational rehabilitation, and then inpatient treatment. It is inevitable at some stages they will require hospitalization to stabilize, do the medication adjustment, and then reintroduce them back into home life or into community living. And so how do you help a child or a teenager who has been diagnosed with schizophrenia? First thing I say is patience. Education is key. This is a lifetime mental disorder that requires medication management and periods of therapy. And so I encourage parents and other family members to utilize all community supports and resources possible. The more they know, the better informed they are, the better able they are to manage the disorder and support and guide the child or teenager, but also help teachers and counselors and siblings and family members and friends understand and know what to do. Adherence to a treatment plan is key, and it also almost guarantees better long-term outcomes for the child or the teenager. So you ensure the medications are taken as prescribed, the therapy is followed through on, promote a healthy lifestyle, maintain a daily routine, observe for any side effects or any different signs and symptoms in behavior. Also, if there's coexisting mental disorders, you obviously have to continue to monitor and treat that. Also work with the teachers in the school. It's not unusual that children and teenagers with schizophrenia drop out before school is completed. Holistic approach, healthy diet, exercise, fluids, limit access to drugs, alcohol. Try and promote a sense of normalcy and independence for the child or teenager. You want to nurture and encourage them, but you also want to monitor them for safety reasons because of their bizarre ideas and thoughts, and also their belief that dreams and TV shows may be real. Monitor for signs of substance abuse, self-harm, and also consider joining a support group for yourself. Also, as parents, I think it's important for self-care and to take time out for yourself as parents, as a couple, as well as doing family activities. And I think the most important, and I say this for every single video, be patient, be there, offer support and guidance, monitor for change, and most importantly, show love. As you can see, it's very overwhelming. Please go to my website to read more detailed information about schizophrenia in children and teenagers. But I hope you found this video helpful. Thank you.